Welcome back to Dr. Noah's YouTube updates, and I go through the scientific literature and kind of interesting things happen. We talked a lot about cancer, especially breast cancer, and about, the chemotherapy, radiation has very little benefit. We talked about the big study that looked over, 900 scientific studies, and over 5 years chemotherapy was only able to increase over 5 years 2.1%. What other industry can claim that we are so great, we should get trillions of dollars, and we able to increase survival time by 2.1% over 5 years? So that's crazy. Well, now there's a new study, which is, once again, the part of the story you never hear. New study. Many breast tumors will spontaneously regress. See, they had this kind of notion that we're so noble. We can't do double-blind studies like that because cancer, without our treatment, these people will die. Well, these people actually, for the first time, and that's what this study says, 6 years show that when the women that did nothing, their cancer started to disappear anyway. So now they're thinking, well, maybe all this crap we're doing, that we're seeing some little bit of a benefit, has nothing to do with the crap that they're doing. Is that it would go, most of these women would go away anyway. And God forbid you have an intervention where you actually make women healthy and then see what happens. And that's what I see and other people see all the time. People that have terminal fourth stage type of cancer, they're told to go home, and for some reason, because only drug doctors can cure, their cancer goes away. So this is, once again, really stirring up a lot of concern here, because this is a hundreds of billions of dollar industry that maybe what they're doing is worthless. So once again, new study just came out. This was published from only Lancet Oncology, November 2011. Remember, 2000, so when you see your drug doctor and he or she hasn't been keeping up like me, they'll just roll their eyes and say, when's the last time you did some research? Oh, well, no, I graduated in 1957. Well, that's it. They're not up to date. Another study in cancer here. Prostate cancer treatments actually increase cancer. Oh, nice! Proceedings of the National Academy of Sciences, one of the most prestigious medical drug journals in the world like that. That's what they're saying, is from cancer research from the University of Rochester Center, saying is that one of the common jokes is that when men have prostate cancer, they give them female hormones because these receptors, these androgen receptors, possibly could be, causing the cancer. Now we know there's been 3 scientific studies showing when they compare men that do nothing, because 95 to 98% of prostate cancer is a very slow cancer. Men die of other reasons, age, cardiovascular disease. They don't die of cancer like that. But once again, it's a billion-dollar industry. Let's cut it out. Let's radiate it. Let's put little radioactive seeds. All garbage. But no, you don't want to go with the real science here. Shows that, said, and this is interesting. This is typical of drug industry type of thing. Short term, there might be a little bit of benefit, but long-term benefit is that it's stated here, by blocking these receptors, cause a reviving up of the prostate cell cancer and can lead to proliferation of cancer cells down the road. So short term, that's what drugs are. Very powerful medicine. Just like drinking lots of alcohol has profound, negative effects, same as with these drugs. And so that's what this, once again, shows you, that these drugs are just, once again, jokes. Sure, it helps you for a week or 2 or a month, but long term it actually causes more cancer and makes you die faster. So that's a good deal. Here's an interesting study showing is about money incentives. This is a big problem. People don't see the high cost of drug care. Their insurance covers it, Medicare, all these things pay for it. They don't do it. So they did a study, and they found in Journal of American Medical Association, there's a 300% increase or decrease on what people do if they find out how much these things cost. So that's the scam. That people walk around, we talked about last week, $15,000 a year is what drug care is per year now. Like that, outrageous. That can go up to $30,000. And because of that, you never see, and I see that all the time, patients, oh, well, I had a hip replacement, I had cardiovascular, coronary bypass surgery, I had this and that, and I said, well, how do you afford it? And I'm just joking with it. How do you afford, $400,000 or $500,000? Oh, I have insurance. Well, okay, you put $10,000 in, you use $300,000. Don't you see? That's kind of weird. Oh, well, I don't care. My insurance covers it. Well, that's part of the problem with the national debt. It's gone into a credit card. We've talked about, an average family of $50,000 a year actually has a credit card debt of over, hundreds of thousands of dollars. I mean, it's nuts. And so that's part of the problem, and that's, once again, that's how this gets stopped. You have your $15,000 that you pay a year, and now you have to use it. So when you see your drug doctor and he or she does these $4,000 or $5,000 or worthless type of exams, maybe you would stop saying, hey, I don't want to spend $4,000 or $5,000 on this kind of crap. I want to go see a real doctor like Dr. No or other doctors that do health, and actually with $4,000 or $5,000 actually make you feel better, and we've talked about that. Another study showing that diabetes equals dementia. Type 2 diabetes, 100% curable, equals basically an increase in terms of having dementia. Brain Clinical Nutrition journal article like that, very, very, very serious. Here's kind of an alarming one, a little off the subject. 75% of the honey out there isn't honey. So when you go to the grocery store, you go to these big boxes like that, this stuff is questionable. Comes from other countries, mostly from China. We don't know what they do over there, but there's actually the scientists that was shown is that 75% of what you buy. That's why you want to buy locally. You want to buy from a real person that actually has bees and selling you that kind of honey, because honey has very, very strong healing properties. But if it's not honey, then you're not going to get that. So beware of that. Microwave containers, just another. Every time you use these, you should use like Pyrex or glass, because when you microwave, you agitate these chemicals, and they go into your food, and it's once again very, very toxic like that. That's not very, very good. Here's another scam: extracranial, intracranial bypass surgery. This is used for different types of carotid type of problems that are supposed to prevent stroke. Well, the problem is they've never done any science on it. They do these procedures. They boast, oh well, Mary or Bill died, but I tried to save their lives because, we know that they were going to have a stroke. Well, now this study here from the University of North Carolina, Chapel Hill, published in Journal of American Medical Association, November 2011, says it's totally worthless. Billions of dollars spent, once again, on stuff that's never been shown to be, scientific, and that's how, once again, Dr. Eddy, E-D-D-Y, Google him up or keyword search him up. He's a professor at Duke, at Stanford. He says 85% of medicine is voodoo. And that just shows you. They do things, they try to pretend that maybe this is beneficial, but where's the science? Where's the proof? Those are the three words that make drug doctors start to soil their pants. When they give you something and say, doctor, that's fine. Where's the proof? And then they'll give you a little song and dance. Well, my drug rep said this or this and that. Well, no, that's when I want third-party, double-blind, crossover trials to show this stuff really works. Well, I don't have any. Then, at best, it's once again experimental. You're the guinea pig. At worst, it's voodoo. So another hundreds of billions of dollars wasted, people being killed for a so-called thing that's supposed to help people prevent strokes. What a joke. And with that, have a nice week. Talk to you soon. Thanks.